Hello everyone and welcome to this lecture about the pathophysiology and classification of burns. The objectives of this lecture. So at the end of this lecture you'll be able to discuss the instances of burns in Australia and New Zealand, the types of burns, the classification system used for burn injuries, and you'll be able to discuss the local and systemic effects of major burn injuries. So burns prevention. So a big part of our job is to educate our patients about how to prevent injuries in the first place. So very important that we do this when we come across a burns patient. So we need to discuss how to prevent scalds, so by moving handles and cups out of the reach of young children. How to prevent contact burns, so keeping a safe distance. And flame burns as well, so removing yourself from the situation, keeping a safe distance from a fire. And then there's explosions as well. Sometimes we're not able to control them in today's society, unfortunately. And friction burns. Now the incidence of burn injury in Australia, so in 2013 to 14, there were 5,430 cases of hospitalised burn injury. So it's quite a large number across Australia. Interestingly, about 2/3 were male. And the highest rate of burn injury was in the youngest age group, so the 0 to 4 age group. And Aboriginal and Torres Strait Islander people made up 9% of all the burns cases, and they had a higher rate of hospitalisation than any other Australian, suggesting that they had more severe burns. So most burn cases had burns of partial thickness of the skin, and they accounted for 70% of the cases, or full thickness, which is when 23% of the cases identified. Now, it's difficult to collect statistics about burn injuries because a lot of people often don't present to hospital. They will treat themselves at home, especially for minor burns. So what were the most common causes of burns? Well, there are different types of burns. The thermal burns, so scald burns are the most common type of burn in young children, and they're caused by hot liquids or steam. So a cup of tea or a hot cup of coffee, a young child trying to pick it up from the bench top and it goes down their chest or maybe onto their face. That's a very common burn injury seen in burns units. And flame injuries are usually quite deep injuries, and that's from direct contact with flames. And contact burns, they're from touching a hot object, so like an iron or a hot plate. And then we've got electrical burns. So electrical burns can be from direct contact with an electrical source. As a current passes through the body, it converts into heat and it damages the tissue. And with chemical burns, this is when skin is exposed to types of acids or alkalis or any other corrosive substances. So these are more common in the mining industry, for example. And then radiation burns, so they can be from UV light, so severe sunburn, or from radiotherapy treatments for cancer, for example. So let's have a look at the causes of burns. Okay, so the data taken from the Australian Institute of Health and Welfare report found that thermal burns are the most common requiring hospital. So the report here looked at the three main groups of burns, so exposure to smoke, fire and flames, contact with heat and hot substances and other external causes of burns. So contact with heat and hot substances accounted for almost half of all the cases that presented to hospital, and that was 45% of cases. Exposure to smoke, fire and flames was the main cause of burns cases in adults, with 78% of cases occurring in those aged 15 to 64. In contrast to this, contact with heat and hot substances was the cause of 37% of burns cases among children under 10. Now let's go on to the classification of burns and have a little recap of skin anatomy here. Okay, so as you can see, we've got the epidermal layer here, then we've got the dermis and the subcutaneous tissue. Okay, so these are the main areas that we're looking at when we're classifying a burn. So the epidermal burns involve the epidermis, so just the epidermal layer here. And in an epidermal burn, the skin will be pink, red, and they're usually quite painful, but they heal rapidly within 7 days. And these are the burns that we usually treat ourselves at home. Unless they're quite extensive, then they will come into hospital for treatment. The next stage of burn is a superficial partial thickness, and this involves the epidermis and superficial dermis. Okay, so just the top of the dermis layer here, and all the epidermis will be gone. And this is when we see blisters developing and red or mottled skin. And these are often painful and will have a lot of exudate coming out, and they heal within a couple of weeks. So then if we have a closer look at mid-dermal partial thickness, so this affects the mid-dermis and above. Okay, so the epidermis is gone, and the middle of the dermis down to here is gone. So there's a large zone of non-viable tissue here, and it is less painful, and there's a lot of exudate, and it's less painful because some of the nerves here have been burnt through. And these burns are pale to dark pink in colour. So the deep partial thickness burns, that goes deep into the dermis, and the skin becomes a pale to ivory colour. The skin doesn't blanch, and this is when hair falls out. As you can see, it would damage this hair follicle here, which is why the hair falls out. And often skin around this area needs to be surgically excised or debrided. So a full thickness burn involves the dermis and the epidermis. This is all gone. So it may even penetrate into underlying structures, so into the subcutaneous tissue. And the full thickness burns, they will be really a dense white and a waxy appearance. The waxy appearance is really characteristic of full thickness burns. Or they may be charred, so they're real black looking. And the skin often feels very leathery. And the term that we use for leathery burnt skin is eshar. Now, this is a great image. I've included this as a PDF in a separate lecture as well for you to download, and there's a link to download this here. But it's a great source of information, which is why I included it. It goes through the different types of burns here, and it shows you images of what they actually look like. So real burns look like. It goes through the depth and, more importantly, what type of dressing you should use on a burn. And we'll talk about that a little bit more detail in another lecture. Okay, so what are the local and systemic effects of a burn? Okay, well, locally, a burn has 3 zones of injury, which you can see here. There's a zone of coagulation, and this is the closest area to the source of the burn. So this is where most of the heat is. You can't even read the text underneath there. This is where most of the heat damage has taken place. And it's called the zone of coagulation because there's coagulation of cellular proteins and destruction of the microcirculation. And that results in the rapid cell death and necrosis. So that's often your necrotic area. Now the zone of stasis around the zone of coagulation here, it's called the zone of stasis because of the slowed blood flow to the area, and it's characterised by decreased tissue perfusion. So this is the tissue that's lost if we don't perform first aid on a burn. Okay. Now, increased capillary permeability results in leakage of the fluid into the extravascular space. Now, the outermost area, this is the zone of hyperemia. It's called the zone of hyperemia. So if you think of hyper, so high, emia, blood, it's the area with increased tissue perfusion. And that's where the healing really starts to take place as the burn starts to heal. Now, the systemic effects, or the systemic damage caused by burns, really does depend on the type and the size of the burn. So burns exceeding 20% of total body surface area are considered major burns, and they will have systemic effects. And the systemic effects are quite complex, and they occur due to the systemic inflammatory response resulting from the cytokine and inflammatory mediator release from damaged cells. And that increases vascular permeability. So all the vessels, if you can imagine them having, so this is your blood vessel, it's got little holes in it. Okay, so this increases permeability and fluid can leak out, and this leads to the systemic problems as plasma leaks from the bloodstream. So this causes a cascade of events including impaired microcirculation, hypovolemic shock, and massive electrolyte shifts as well. And this response actually affects most of the body systems. So the effects on the cardiovascular system are a reduced cardiac output, increased afterload, and a decrease in contractility. Now, following a burn, our body goes into a hypometabolic state. This leads to increased oxygen consumption, the release of adrenaline and noradrenaline, and cortisol, which is a stress hormone. And this results in a higher body temperature. And immune function is suppressed, which increases our susceptibility to wound infections and potentially sepsis. So impeccable infection control is so important with burns patients. In fact, patients with severe burns will be cared for in specialist burns units and negative pressure rooms and heated to a certain temperature. It really is specialised care for the severe burns. So here's a list of all the references. There's a lot of references here and lots of interesting information about burns. So I encourage you to do further reading around the subject. I hope you enjoyed this lecture. Thank you for listening.